Well, good morning, everyone. Welcome to a slightly steamy media roundtable and slightly steamy Rio today. My name is Professor Sharon Lewin.
I think it's important for us to really talk about what is happening here in Fiji, because it is a lesson of what can happen everywhere else in the world. So some further background. So Fiji is a country with fewer than 1 million people, and in January 2025, we declared a national HIV outbreak, which was initially thought to be confined to populations of people who inject drugs. The epidemic is now spilling over into every other population group in the country. New HIV diagnoses increased 14-fold, as Sharon has shared, over the last 5-year period. UNAIDS estimates that we currently have 1.2% prevalence in populations from the ages of 15 to 49, and that, of course, continues to increase. That's roughly 1 in every 60 adults will have HIV in our country. In a country that over a decade ago you would not have heard about in the HIV map. So for us, it's really significant, and for somebody that works in the region, it's very concerning. The prevalence in our antenatal population now exceeds 2%, and in 2025, 1 child was born with HIV every week, and we lost 1 child to HIV-related matters every month. So in a country of less than 1 million people, this is very significant. And perhaps for me is the most greatest crime and shame of all, because this is all preventable. UNAIDS has described Fiji as having the world's fastest growing epidemic last year. I wouldn't be surprised if that would be any different this year in their report. What is driving this epidemic now is risky injecting drug use among populations of people who currently inject methamphetamines. And it is the largest number of infections as a result of intravenous drug use. So our epidemic is a very young epidemic. 2 in 3 of last year diagnoses in people from the ages of 20 to 34. This methamphetamines is actually being injected. And for us, what is unique about our injecting drug use in Fiji is that people start off injecting rather than smoking or snorting. So our response, Fiji has responded very quickly and hard. We have introduced PrEP very rapidly, and we're trying our very best to scale that up. There is no opposition to PrEP, and I'm always so surprised to hear about countries that are still challenged by this. I used to work in Southeast Asia, so I'm well aware of a lot of oppositions in many countries to PrEP. I'm very grateful that I don't have that challenge, because it's the last thing I need is to receive opposition to PrEP. We've increased our peer outreach programs. We've introduced community-led programming. We have a long way to get that right, but it is a central part of what we do from the Taskforce. Many people in other countries are challenged by the community's central role in the response. That has not been our challenge in Fiji, so I'm grateful for that as well. We're trying to strengthen our condom programming in a region that does not use condoms. So for us, the biological interventions is essential to our response, because we know it's probably a losing battle if we're trying to focus on a condom program when historically we have not been very successful at this. We're trying to integrate HIV care from 3 clinics into all primary healthcare facilities across the country, and we're expanding that as fast as we can. More innovations are to come, and which is only possible with a strong political will and commitment we have received from our government. I can't tell you how grateful I am to the Fiji government's full support on everything that we need to do from the task force. Now, our epidemic continues to be driven by risky injecting methamphetamine use. Our prevention is a central part of our response. What is missing from this response is the availability of a needle and syringe program that is a central part of a harm reduction program. We have other elements of the harm reduction program, but a needle and syringe program. This does not mean there's no will to do it in the country. There's a lot of will, especially from our politicians and government, but we need to introduce the systems first and introduce this. And once it's introduced, we will scale this up very rapidly, and that's my hope for the chair of the task force. The consequences are already before us in the country, as I've already shared. In 2025, UNAIDS estimates that our upper bound number of people living with HIV is 8,900 people. Reminding you, it's a population of less than 1 million. So for us, 8,900 is a significant number. The estimates for this year has come back at 12,000, which means that there's a substantial increase from one year to the next. And I think a lot of that is to do with the failure of us to introduce a needle and syringe program. And that's for us something that is very important for my task force to introduce. Against the estimated burden, we have diagnosed only a fraction, roughly 3 in 10, with 1 in 6 on treatment, and documented viral suppression only at 2%. And we have, of course, our next generation, we are concerned about the mother-to-child transmissions, which continues to climb. Last year, our vertical transmission rate was one of the highest in the world. It was at 18%. So for us, the regional concern, and when I say regional, I'm talking about the small island developing states of the Pacific. Anything that happens in Fiji has the potential to impact other Pacific Island countries because the majority of students are sent to Fiji for education. They're not there for a week or two, they're there for years at a time. So for other Pacific Island countries, they are concerned about what is happening in Fiji. Their question to us always as a country is, what are you doing about your epidemic? Because it has the potential to spill over into these countries. So of course, for us, whatever happens in Fiji is a warning sign of what might happen in other Pacific Island countries. So despite all our efforts, we have been very supported, and generous support has come from our neighbors, Australia and New Zealand, of course, through DFAT and MFAT. We have a long way to go in responding to this epidemic. And we are therefore calling on the global community to not turn its back on Fiji and other small island developing states in our region and other regions that have small island populations, because we stand to lose a lot. Many indigenous populations are at risk as a result of something like HIV. We have seen this in the past with colonial administrations, where lots of populations have died off as a result of infectious diseases such as measles. And so for us, that is a central concern from us from the Ministry of Health and for the Pacific as a whole on how that can impact such very small populations. The island that I come from, there's less than 1,500 people living on that island. And there are already signs that infections are now appearing on our small island countries and also small islands that are part of the Fiji group. So with that, I will stop and hand over to you.
To let you know on what I do in our country in Fiji. So just to remind you, my name is Mark Lal. I am 25 and the founder of Living Positive Fiji, which is a social media platform that raises awareness for HIV/AIDS in our country. I created that platform 6 months after I was diagnosed and came out publicly on December 1st, 2024. And its purpose was mainly to help our youth, because I've been seeing that so many young people have been going in the clinics, getting diagnosed, etc. And coming from a community perspective, our situation in the country isn't really that good. We lack so many things that actually needs to be done. For example, what Dr. Jason just mentioned, the needle syringe program is something that really needs to be implemented, and it is not. We constantly run out of medication that have just been introduced and no one really knows about it. No one really knows about antiretrovirals itself. So these are many of the things that actually needs to be actually changed in our country. Needs to be more proactive. And yeah, I'm basically just waiting for the questions to shoot in what you guys have, because I believe Dr. Jason has covered most of what needs to be said. Thank you.
And to support those organisations to deliver programming to communities in Fiji, but also to demonstrate what we've learnt in Australia, and that is that responses to HIV are strongest when they are community-led. And so we look forward to being supported by DFAT to deliver the kind of work that we've done now for 40 years in Australia in the region.
So we, like Dash has said, really welcome the Australian government's commitment and support to this issue. It's something that we're very conscious, as Jason alluded to, is a response of a situation that's likely to or has the potential to spread across the Pacific. We recognise that we are neighbours. Australia is neighbours to the Pacific Islands and to also Papua New Guinea, where they see an incredibly high caseload as well of people living with HIV. So we see our role as integral to being able to provide that support and assistance. And so as I say, we do welcome the $48 million investment that DFAT's providing, which Senator Penny Wong from the Australian government announced earlier in December.
Pacific, the world's largest epidemic after that in Eastern and Southern Africa, accounted for almost a quarter of annual new HIV apprehensions and new HIV acquisitions since 2014, linked to rising supply of crystal meth, which has been injected amid gaps in harm reduction. Thank you so much to our speakers. Each of them will be around for any further questions. You may want to hear more about strategies that our community have led in Australia. I think some further details of what is happening in the Philippines and the amazing use of social media that Love Yourself have used for accessing PrEP, astronomical increases in PrEP. So if any of you'd like to speak to our panel, please feel free. Thanks again for joining us, and special thank you to Jason and Mark for coming to AIDS 2026. IAS is here to support people who are going through this experience in your country, and our main role is to connect people globally with the shared fight and all the different lessons that all of the attendees have here will hopefully benefit what's happening in Fiji. So thank you very much.